Hello, thanks so much for joining me today. I'm going to spend about 15 minutes talking about how our attitudes and access to healthcare has changed over the past 11 months as a result of the pandemic. My name is Chris Morris. I'm a GP in the NHS, and I'm also the medical director for GP services for HealthHero. I've been providing remote GP consultations for the past 20 years in the private sector, and I've also done this a great deal in my own surgery. And it's striking how much the way healthcare is accessed has changed over that time and has really accelerated over the past year since we've all been subject to the coronavirus pandemic. We did a survey in the first week in February in which we spoke to 2,000 adult patients in the UK about how they access healthcare and how their health has been affected by the changes to the way we do this during the pandemic. And it's amazing that so many people are actually avoiding going to contact their GP. About a third of people that we spoke to have avoided contacting their GP for a variety of reasons. Some of them were just trying to keep out of the way of the NHS, to let the NHS look after the patients with COVID-19. Some of them didn't think their problem was really serious enough to go to see the GP. Some of them were taking the government's message about protecting the NHS to heart and just trying to keep their distance from the NHS. But about a third of people actually avoided going to the GP surgery because they were worried about contracting the virus from other people while they were out and about and going to the GP surgery. And this has had an effect that some people are now left uncertain as to how to access healthcare, and particularly those who've got pre-existing medical conditions. So the way we access healthcare and our attitude and our ability to get healthcare has really been affected since March last year when we went into lockdown and the pandemic started to have such a great effect on our lives. Now, the pandemic has had some positive effects on our health. It is incredible how low the levels of influenza and the common cold are this winter compared to previous years, especially the previous 5 years. I think this is in part due to the significant increase in the uptake of flu vaccinations that have been offered by the government over this winter season. I think also we're washing our hands more, so that reduces the spread. We're also not going to the pub and the restaurant and the cinema and collecting in public places and sitting in GP surgeries where patients are coughing over us and sneezing over us with their colds and their flu. And also children have not been going to school for the past 6-7 weeks. And we know they're a big spreader of influenza. They spread the virus around, they come home and they give it to their parents and their grandparents. So that's been a positive effect of the pandemic for our health. But there have also been some significant downsides on our health. We know a lot of us are eating more, so our weight's gone up. Patients are telling me, and so many patients I speak to now are on a diet to try and lose the weight that they've gained during the 3 lockdowns that we've had. Patients who are not accessing their GP say that their physical health is affected as a result of this. Some are having pain as a result of physical ailments that they're not going to see their GP about. And particularly patients who've been asked to shield due to the medical conditions feel that their pre-existing condition might have got worse. And I think perhaps in many ways, most worryingly, about 50% of patients who've not contacted their GP feel that their mental health has suffered. And we all know that the pandemic's had a big effect on us. It's increased loneliness, it's increased isolation, people are staying at home and not mixing, people are overworking because those of us are lucky enough to have jobs that we can work from home because the work is in the house and you don't need to come and go for it. We're probably drinking more as a result of it. We know that alcohol sales from supermarkets have gone up. And I work in the drug addiction service as well, and we know that we're seeing more patients presenting with alcohol-related problems. And stress and anxiety has gone up significantly. People have got worries about their jobs, significant concerns about their financial situation, their financial future, and this is, having a significant impact on people's health and well-being. So what do people do who are avoiding contacting their GP? Well, we've got Dr. Google now, and an awful lot of patients are Googling symptoms. and trying to find out for themselves what their problem is and to try and find self-remedies. A lot of patients phone a friend, ask family, that we've gone back to asking granny what we should do, as we used to three generations ago, when we didn't have doctors. A lot of people do nothing about it. They just suffer in silence and think, well, I'll just put up with it until I get better, or it gets much worse and I have to go and do something. Some patients are accessing workplace-based schemes for health advice, and 13% of patients that we spoke to had sought out private healthcare, of whom 71% had done this for the first time. And nearly all healthcare now at the moment in primary care for GPs, but also hospital outpatients. I know my patients, when they're having a hospital outpatient appointment now, it's being done remotely. I think all the GP surgeries that I'm aware of are offering, as their primary source of talking to patients, telephone or video. And I say telephone or video, it's mostly telephone, because although we're comfortable with having Skype or Zoom or Teams meetings with our family and friends, we seem reluctant to have a video chat to a stranger. And so therefore, it does seem to me that patients are mostly accessing by telephone. However, I think there's an increase in video use. I think it's gone from 5% to 15% of calls over the pandemic. So people are becoming comfortable with video, and I think that that will improve significantly. I also think that the ability to send in photographs, because most people who have got a smart camera now got a smartphone, have got a really good camera on it, and certainly in many cases that photograph that they can email or text into us is good enough to see the rash or the lump they're trying to show us, and to have a good consultation with them as well for that. And so I think that the remote consulting is now the norm, and I think it will be the norm when the pandemic is over. I think that lots of GPs can see the benefit of this. It's great for the carbon footprint. It's great for having waiting rooms full of patients who are coughing and sneezing over each other, and it improves flows through surgeries. Car parking isn't an issue anymore, and having people being unwell in the surgery, when you talk to them at home and get them healthcare, and perhaps by calling an ambulance for them, is better for them. And those also who've got disability or mobility problems don't have to struggle down to the GP surgery. We can talk to them from their home or from their workplace. And 74% of patients that we spoke to said they were quite happy with remote consulting, and over 80% found the technology easy to use. And it didn't matter what age group they're in. So even the baby boomers like me found it as easy to use the technology as young adults. So employees are now very used to using remote tools for talking to people, whether that's their colleagues at work, or their GP or nurse or healthcare practitioner or physician associate or pharmacist, or whichever healthcare professional they're talking to. And nearly 70% of the people that we talked to who were employees felt that the pandemic was going to change how we access our healthcare, and that remote consulting with GPs is going to accelerate and become even more popular and common. So what are the advantages of remote digital healthcare for employees? Well, you haven't got to now take time off from work to go to GP surgery, to hope to get a parking space, to sit in the waiting room to be seen. You can continue to work from home or from your office, wherever you might be. And when the time comes, the GP or healthcare professional will normally call you. So your ability to stay in work is that much greater. The fact that you can get this appointment and not have to take time off, I think means you're more likely to seek healthcare advice, because you're not going to have to take off half a day to go to the appointment. The 10 to 12 minutes average it takes for a GP consultation, you can now fit that 10 to 12 minutes into your working day from home. And I know lots of patients I speak to, they say, "Oh, I'm just gonna nip out of the office into a quiet room," or they're actually already in a quiet room because they're at home, and they just close the door and have the consultation with you. So I think it increases, makes it easier for people to access their healthcare, and I think that therefore is going to reduce absenteeism, because they can access healthcare more easily and they're more inclined to, but it will also reduce presenteeism because people will be more willing to access easier to access healthcare, and therefore getting advice and taking the time off when they should be taking time off. And this will improve productivity, I think, for employees. I've got lots of employees in my GP surgery, and I'm as worried about them and their healthcare as I am about my patients. And it will improve attendance management. And I think, therefore, it can improve recruitment and retention and job satisfaction if you're feeling better and happier and healthier in your work, and you're more confident about how you can get to see somebody when you need to without it being a big problem. Because a lot of us feel guilty about taking time off work to go and see the GP. And if you don't need to take that time off but still have a consultation, I think that's good for everybody. So I just want to talk about 3 patients with backache that I've consulted with remotely over the past couple of months. And they're all fit, healthy patients, other than with the problem they had. They were all in work, and in fact, they were all working from home, and they were able to get healthcare remotely with relative ease. There was a lady in the mid-30s who had really painful back for a few days without doing anything to cause the back pain, and then a rash came up. And she was able to send me a photograph, and the photograph showed shingles, and I could see that quite clearly. I was able to prescribe for her, send a prescription to the pharmacy. So she only had to go to the pharmacy to pick it up, and she could get that treatment relatively quickly and easily. And that's really important for shingles, which is an incredibly painful condition, because you need to start the specialist treatment within 48 hours of the rash coming up. So by able to get that treatment to her, that improved her return to work. Compared to not getting it. I spoke to a chap in his late 30s who did what we've all done, where he twisted and bent, and typical when children, he locked his back. And he could still work, but he was in a lot of pain and discomfort, and he got on for a few days, and he wanted to have an MRI scan. We wanted to know if he needed an MRI scan. Now, from the symptoms he had, I didn't believe he needed to have an MRI scan. There was no indication for him. So I was able to give him advice about self-care, about what medication to take, about exercises, and reassure him he didn't need a scan, which had stopped him taking time off to go to see his GP, to maybe get a referral, to maybe get the scan done. So we got him back to work, I think, more quickly. Lastly, I spoke to a chap in his early 30s who'd had a fall in the bathroom and just fallen on the edge of the bath and hurt his back, and it had been okay for a day or two, and then it gradually got worse over time, and he found that if he moved or twisted or took a really deep breath, then he got a lot of pain. He was worried he'd broken the rib, and he wanted a chest x-ray, or rather he wanted to know if he needed a chest x-ray, and he didn't want to go to the hospital, he didn't want to go to the emergency department, so he thought it'd be a good idea to just check with me if he needed to. Now, he didn't need a chest x-ray. Even if he'd broken a rib, we don't do chest x-rays. You just need to have advice about the warning signs and how he can help himself get better. And so by talking to this chap, I'd saved him a trip to the emergency department that he otherwise probably would have done. He would have sat there for 2 or 3 hours to be told he wasn't going to have a chest x-ray. And instead, he had advice, reassurance, was able to stay at home working, and that improved his productivity, his reassurance, but also gave him the advice that he needed to carry on working and the confidence to stay in work rather than taking time off. And all done from the comfort, although in all 3 cases they were in discomfort, of their own home. So I just want to get some advice for you to give to your employees, if you want to, and your colleagues and your friends, about how to keep healthier in these difficult lockdown days. Nutrition is really important. I'm a big fan of nutrition. I think it's something which is not well enough covered in the training of medical professionals. It's something which we're now recognizing that is a greater value. Now, we all know about 5 a day, and I would encourage everybody to have 5 a day, particularly of vegetables rather than fruit. But if you can't manage 5 a day, at least try 5 a week. At least try 5 different colored vegetables a week. And the advantage of these is that the different colors help to feed the trillions of bacteria that you've got in your gut, called your microbiome, that we now know play an increasingly valuable role in our general health and well-being. And they like different colored vegetables. So give them some vegetables, make them different colors. Hydration is really important. Hydration is really important for concentration, for general well-being, for our immunity, to reduce aches and pains. And we should be drinking, we think, 2 litres of water a day. That's a lot of water. And if you drink 2 litres of water a day, it's going to move you on to the third problem, which is movement, because you're going to have to get up to go to the toilet. And movement's really important. A lot of people can't exercise in the way that they did beforehand. We're walking, but maybe not as quickly. We're not stressing our hearts, but at least get up and move. I'm a big fan of supplements. I think there's advantages for taking turmeric because of its anti-inflammatory and immune properties. I think vitamin C is important to help us fight off viruses. But if you only take one supplement, take vitamin D. I think every adult on this island should take vitamin D throughout the winter because there's just not enough sunlight here to make our own vitamin D, and it's really quite hard to get it from food. And I think if you're a person of colour, you should take vitamin D throughout the year because there isn't enough sunlight in the summer to make vitamin D. So supplements are good, vitamin D is really good. And get some rest. HealthHero, we have an hour off each day when there are no meetings. And over lunchtime to try and encourage people to take a break because we're all spending long hours in front of our laptops and our PCs and our Macs at home working because we haven't got that travel time, therefore we might get some extra work done. So have some rest, take some time off and try and get the 7 hours of sleep that we think we need each night. I hope that's been of help to you in your roles. I hope that's a message you can pass on to your colleagues, friends, families, employees. And I hope that's been some interest to you. Thanks for listening in today. It's been a pleasure talking to you.